Sober Boundaries is designed as a discussion and information sharing platform when it comes to enjoying and having success in sobriety. Hello, welcome to Sober Boundaries. My name is Wade Davis. Do me a favor and hit the subscribe button along with the bell. That way you'll be notified each time we post a new episode. Thank you. This episode will contain tips and information that will give you a better outlook while going through a substance abuse treatment program. Okay? Not only have I been a patient multiple times going through substance abuse treatment, I have also worked as a nurse responsible for the care of addicts and alcoholics in both the clinic and hospital settings, and I did that for over 6 years. I also facilitated treatment groups. Okay. If needed, find someone to help you get your affairs in order before going into treatment. You know, watch your house, pay your bills, feed your pets, etc. Also, if you're working, talk to your employer. They need to know what's going on with you, and they may offer a level of support. They may pay for it. Okay, so that means learning to be totally honest in all your affairs can take a mountain of stress out of your life. If you need to, also get your affairs straight with your family, as they can be an unneeded distraction in treatment. Trust me, once you get admitted, you don't need to have any worries about the outside world. Your focus needs to be on finishing the program with the correct state of mind, along with the life-changing tools given to you by the program, right? So remember, staying clean and sober needs to be the most important goal in your life. Why? Well, think about it. While you were using, any success you had was always temporary. And eventually, because of your substance abuse, it turned into a failure. So without sobriety, anything you try will always fail. The decision to stop using will be the most difficult one that you've ever made in your life, because no longer using your substance of choice, it'll feel like the death of a close friend, because it was there for you, right? Although some individuals quit using and stay clean and sober by sheer force of will, it has always been recommended to sign into a program. Yeah. Okay, listen very carefully. No matter what type program you choose, make sure an evaluation of your current health is part of your program. Okay? And there should be periodic monitoring of your health. Why? As a nurse in a treatment center, I was responsible for vital signs. At a minimum, we would check blood pressure, temperature, heart, respirations. Some people needed EKGs, blood sugars. This was usually accomplished 2 to 3 times during a 24-hour period. Okay? Now, as a patient, this may seem like a pain in the neck, us checking your vital signs all the time. But many substances can sometimes be fatal to someone going through withdrawal. Therefore, the staff needs to know how your body is doing. Now, understand this, depending on your drug of choice, withdrawal may seem like and could be the toughest fight of your life. All right? Now, there are 2 basic types of withdrawal: active and passive. Okay? Active is the extreme discomfort that you experience as your body reacts to not having the substance in your system. Whether it's cocaine or alcohol or whatever, you're going through withdrawals. All right. Normally, there are medications that are given by the doctor to help you with this withdrawal. But understand this, even with the medications, most people will still feel like crap for what seems like forever. But eventually it will stop. Now, and I want you to remember how it felt the next time you consider drinking or drugging, okay? Okay, now, while active withdrawal seems like the most difficult challenge, passive withdrawal can be with us for years because that is in our mind. And the only way it will go away is to change the way we think. This is one of the goals in treatment. But still, you must understand the recovery rate from substance abuse, even going to treatment, is still very poor. Now, here are a few tips that will help you in treatment. Number one, stop and ask yourself, why am I here? Yeah. Now, for all but the last time I was in treatment, my motive was not to stop using. I was homeless and I needed a place to stay and a break from the misery. Now, if you're not in treatment to get clean, sober, and get your life back on track, you are wasting your time. Now, it is possible to make this your motive while in treatment, so give it some serious thought. You can make it happen, okay? Number two, do not make any friends in treatment, only brief acquaintances. And delete all, and I mean all, of the phone numbers in your cell that had anything to do with your substance abuse. These people are not worth your life. In recovery, not making friends but only acquaintances will allow you to focus on yourself. All right. For the first few seasons in sobriety, your thinking should be this: me, myself, and I. Me, myself, and I. And this should start in treatment. Unfortunately, some friends turn into romance. That's why they don't want you to do that. And this is an absolute disaster. So, really, focus on yourself. All right, tip number 3. Keep a journal, not for just your thoughts, but also for your questions. Write down all the questions you have and keep this list of questions with you and only get answers from the staff. Now, never take any advice from other patients. Just stop and think about it for a moment. Just think. Take a moment and think of just how stupid this would be. You know what I'm saying? You got that? Okay. All right. If a treatment tech or a nurse cannot give you an answer, you can always ask your counselor or ultimately your doctor. Okay, tip number 4. Listen, when you ask your counselor or doctor a question and they tell you they need to get back with you with an answer, politely ask them, hey, what would be a good day and time for you to check back with them? All right? Write that down and make sure you don't miss the appointment, because now there's a good chance that you won't be taken serious. I say this because, unfortunately, some treatment centers are understaffed. So you need to be very patient. All right. Number 4, your facility will be full of all types of personalities and attitudes and everything. So focus on your treatment and stay out of the drama and the gossip. Number 5, review and study all the literature and finish all your assignments. You need to get up and attend and participate in every group, presentation, meeting, etc. Understand this. In recovery and ultimately in life, applied knowledge is power. Okay? Number 6, finish the program. Yes, after living a confused and chaotic substance abuse lifestyle, following the structure of any program will be tough. But remember, you are fighting for your life and peace of mind. So you need to put everything you have into finishing. And let me tell you something. The day you receive that certificate of completion, you will be filled with a sense of awesome joy. You will. So, hang in there. In treatment, you will learn how to get and stay clean and sober, but you also need to know what to do next, right? In the next and last episode of this series, I will present a group of choices you may need to consider to help you turn your life around. Trust me, most people don't get this information. The counselors have it. This list can help you decide on what to do next. So make sure you join me for the next episode. Okay, number 7. This one's kind of raw. Remember, once physical withdrawal is over, the battle is in your mind. So listen very carefully. One mind technique that I use is to count all the other patients and look at them and decide that you're the only one that's going to make it, and the rest of them are out of luck because you're the only one that's going to make it. You must say this to yourself constantly. Remember, you are the only one that is going to make it. What? Selfish? Yes. But were you selfish in your substance abuse? Well, yeah. Well, it's time to turn it around and use it for your advantage. What this will do, it will subconsciously make you responsible for your own sobriety and help you gain confidence in your decision making. So take heed, because trust me, it works. If you like the content on this channel, please hit the subscribe button and also hit the bell so you'll be notified of our next episode, and post any questions or suggestions because we would like to hear from you. Thank you for joining us. My name is Wade Davis. Hope to see you next time. Take care.